Welcome back to Yahoo Finance Live. I want to continue this conversation about the coronavirus pandemic. We're joined now by Dr. Suzanne Judd, Ph.D., epidemiologist at the University of Alabama at Birmingham School of Public Health. Dr. Judd, great to have you back with us. Now, we were just listening to the Novavax CEO, Stanley Erck, chatting with us about his vaccine and a lot of the concerns that have been raised about AstraZeneca's vaccine. We've seen countries across the world, several of them suspend their use of that vaccine, which I think raises a lot of concerns and questions for folks at home, especially those that already had vaccine hesitancy. So now that we're seeing this news that perhaps that vaccine might not be safe, I'm wondering what concerns that you might have outstanding about the safety of some of these vaccines that are currently being used.
So that's a great question. And in public health in particular, we're concerned that people will take what they're hearing about AstraZeneca and they'll apply it to Pfizer or Moderna, which are very different vaccines, and they've been used quite safely in millions of folks across the United States. So I don't think it brings into any question the vaccines that we're currently using, because we've had so many people that have received the vaccine already, and CDC is tracking the side effects. So we're able to get real-time information on those vaccines. A little bit slower on the J&J vaccine because it hasn't been around as long. But again, there are still lots of people that have already received that shot, and the side effect rate has been very low. So I'm not too concerned that what we're seeing in AstraZeneca will be something that we'll all of a sudden start seeing in the vaccines that have been on the market for a while.
Now, just in the last segment, I did, tell everyone at home just where we stood, at least when it comes to the pandemic. Here, we're seeing the cases decline by about 20%, but globally, they're spiking by over 10%, 11% specifically. And now we have this hole that's going to be left behind because so many countries are not going to be using that AstraZeneca vaccine. Now that we've essentially taken one of those vaccines off the market for so many millions of people around the world, do you worry, at least globally, that we might have been pushed a little bit back in the race to really fight against this virus?
Without a doubt. I think that's one of the things you're seeing right now in Europe. They've been a little bit slower, particularly in Italy, to get vaccine into people. Where here in the U.S., we've been more aggressive at getting people vaccinated. And I think that's one of the reasons you're seeing cases drop off here in the U.S., but that's just not the case worldwide. And as we start to see the U.S. relax because we get more and more vaccine and cases decrease, you're naturally going to see international travel increase. And when international travel increases, we could see spread from some of these countries that still haven't really started to bring the pandemic in control through vaccination. So to me, that's a huge concern in the next 6 months that we're going to have to pay very close attention to.
All right, let's talk, here at home, here in the United States, because we have been speeding up the vaccine distribution. And now, of course, we have this good news about the Novavax vaccine, roughly 90% effective and also effective against that UK strain and variant of the virus. We have a pretty ambitious deadline. July 4th is when a lot of folks were told we're going to be able to barbecue, hang out with our friends and family by the president. Wondering if you think that we're going to hit that target.
I really hope so. If we keep going on the path we're going with getting the vaccine into the states, we should be able to hit getting enough people vaccinated that would make it safe. I think the big question is right now we know that the supply for the vaccine is lower than the demand. So we were able to get people vaccinated pretty quickly each day. But as we start to get to the point where you've got those people that are hesitant to take the vaccine, which will probably be somewhere around 40 to 50%, then the pace may slow. And then we may wind up with more vaccine than we have people willing to get it. So we might have to shift our strategy at that point. One thing that could really help is if the FDA changes the vaccine from emergency use authorization to allow healthcare settings and schools to require the vaccine. Currently, it can't be required because it's only an emergency use authorization. So you may see some of those types of policies change that would help to get more people vaccinated if they have to as a part of their job or going to school.
Now, what you're talking about here, right? We've been able to see these cases decline for a myriad of reasons, but also because that speed of the vaccine, that distribution is running ahead of the transmission, at least for right now. But if that slows, as you're mentioning, do you worry or fear that we could perhaps see what we see going on in Italy and in Germany, which is a reversal of that downward trend, and that we'll start to see spikes again, particularly as those vaccine hesitant folks are some of the biggest outliers remaining to taking the vaccine?
Absolutely. If we don't get up to 60 or 70% of the population vaccinated, we could easily see some backsliding. Because keep in mind that with a vaccination campaign, you know that some people that were vaccinated could still become infected. It's a very small number, but it's still some. So we really want to get more like 70, 75% of the population vaccinated to be sure we don't see that backsliding that you're seeing right now in Italy.
I want to ask you a very quick 20-second question here. When do you think we might be able to achieve that herd immunity? I don't know if you have a specific date, but do you have a season perhaps?
Summer. I think we could say summer pretty safely. I think the Biden administration has it right at that July 4th that we should be in good shape. We may already be seeing some of the benefits of herd immunity right now with the cases dropping off the way that they're dropping off. That's going to be our biggest indicator as to whether or not we're there. If we keep seeing declines, we might be already there.
All right. Well, that is incredibly good news to end this conversation on. Dr. Suzanne Judd, epidemiologist at the University of Alabama at Birmingham School of Public Health. Thanks so much for joining us.